women especially, we value our relationships
Mm-hmm.
and how we do things. And I think at the core of a good business is about purpose, integrity, doing things well.
Mm-hmm.
If you don't like the people you work with, don't spend time doing it.
Welcome to That's Darn Good. I'm Janelle Ball, and I'm excited to bring you thought-provoking conversations about biologics, specialty medications, treatments, and so much more. I'll be chatting with some amazing guests about access, affordability, and advocacy. You're really going to enjoy this show. Welcome to That's Darn Good. Today, my guest is Dr. Jennifer Linder. Dr. Linder is the founder and chief medical officer of Linder Health. Welcome, Dr. Linder. Thank you for joining me.
Hi, nice to have a conversation on this beautiful day.
Yes, I'm so excited to jump in and talk to you all about all the amazing things that you're doing. Number one, as the founder of Linder Health, but you're a board certified dermatologist, fellowship trained Mohs surgeon, also biomedical engineer and chemist. I mean, amazing. So tell me where all this started. What even made you decide, I want to get into dermatology? I want to develop a company, be a founder of multiple companies.
I'm obviously a dermatologist, and when I was in my fellowship, which was a laser and Mohs skin cancer fellowship, my melasma got significantly worse because I lasered it. Because if there's one takeaway I'd like people to learn is please don't laser melasma unless you are literally like a world expert in pico laser or something. So peels really are what work great for melasma and pigmentation. And that's what I learned is less is often more. Linder Health is my second skincare company that I founded. My first one was called PCA SKIN, and that one was founded about 25 years ago. And it was basically a little nugget of a company called Physician's Choice of Arizona when I bought it. And it came into my life because during my laser fellowship, I made my melasma worse. And actually, one takeaway for all the clinicians out there is please don't laser melasma unless you are truly an expert in laser, because it may get better the first time, but it could get subsequently worse. And so I really deeply believe chemical peels are the way to approach melasma and pigmentation. And that's what I learned when I was a young dermatologist. And I had one of my skincare companies recommend that I try these superficial chemical peels from a company called Physician's Choice of Arizona. And they worked. And long story short, I visited the company and it was like the old Remington microscreen commercial. I liked the company so much I bought it. And basically turned this nugget of a company into what became Physician's Choice of Arizona. Grew that to 72 countries, 15,000 offices, and then sold that to Colgate-Palmolive in 2018. So I had this journey of entrepreneurship at the same time as running a practice, and I loved it, and I deeply loved the science of it and using chemistry to do product development and doing things well with integrity. And especially when I really started this, there was really a lack of education for people outside of dermatologists themselves. So your staff that was working with you, your estheticians, patients, and such. And so education is a big part of what we built out. Well, then during COVID, I realized that there was room for improvement in terms of we started really understanding more about what was happening with the aging process and the role of inflammation in that. It's viable to all the different organ systems, but it's especially important to the skin. And peels really had not been updated in, close to 50 years in many ways. During the 90s, we got glycolic acid peels and started getting blends. But we hadn't really thought about thinking from the chemistry side, what ingredients are doing, how can we make it better, and then understanding inflammation. So while everybody else started baking sourdough bread and such, myself and my original team, because I stayed super close friends with my original team, we started doing chemistry again and developing some different peels for ourselves, and then realized, oh my gosh, there's space for this. They work so well. I think we should maybe do this again. And that was sort of the impetus for what became Linder Health, was starting at the chemical peel place and what are the problems for the clinician and patient and how do we make them better. So that's like a really long story short as to like the why is, there's room for doing it better. And I think we can get to minimal downtime with minimal discomfort and make things easier for the clinician as well.
Oh,
So
I have so many questions. That was such a good information. So PCA, the focus was on like chemical peels. Is that what the main?
Yeah, so chemical
Okay.
peels we've made, and the company still makes, I think, more chemical peels than I think any other company in the world. And they do a lot of blended chemical peels, a lot of skincare as well.
Mm-hmm.
And what I found is, once it became a giant corporate structure, things weren't as quick to be able to change things.
Mm-hmm.
I would see the need to improve something or change it. And it's like watching a child go off to college. They have their own successes, but they also make their own failures. And I was in the position where I could do it again. And so that's kind of what happened. Was I love this industry so much. I really love working with people who love working with skin, whether or not they're estheticians or physicians. And I wanted to make things easier and make people feel more confident in using chemical peels. Because I think just the name alone can sound scary to people who don't know what they're doing, right?
Right.
And so that was because it sounds like chemistry, and chemistry can sound scary. And it's like, no, it's like a beautiful, the way we design these, you could actually do it as a part of a facial. You can do it in concert with a laser. And it's actually a soothing, nice experience rather than something that's uncomfortable, and more importantly, minimal downtime. So it just comes off as tiny little flakes, almost like dandruff, rather than like sheets, like a snake.
It's funny. I've had a few chemical peels before, and this was like years and years ago, my first chemical peel, and it completely peeled my face. Like I had some really, really good like peeling going on, but I was like, oh, make my face peel. The more it peels, the better outcome is going to be. So I was always like, oh yes, I need to peel all that skin.
I've been there. I had the same thought process. Like the more it hurts, the more it's like, oh, it's gonna be
like,
good.
Whoa, you look like you just got peeled off 10 layers. So it shouldn't always be like that.
No, matter of fact, and that's what we've kind of learned is that's happened. Peels, one of the things they do is trigger cell turnover. One of the things they do is they trigger wound healing and that whole process of regeneration. But it's about finding the sweet spot. So you do those things without getting to the point where you go 3 steps backwards to go 2 steps forward. So instead, what we can do is by controlling the inflammation component, by controlling the pH as well as percentage of peels and which blends of peels we do, we don't have to have so much irritation and the actual peeling happening and that redness and all those things. Like, did you ever watch Sex and the City? And Samantha Jones got a peel and she was bright red, and everybody, I think after that was like, oh my gosh.
Yeah.
It does not have to be like that. So that's what I like to say is that's what we don't want to happen. It's like, it's almost like when somebody gets filler in their lips and it's big giant duck lips. That's not what we want to happen. You can get beautiful results without that happening. It's kind of a similar thing, but it is about controlling the chemistry of it. And so in the last few years, there was some really beautiful data that showed that if you do at a pH between 3 and about 3.54, which is actually a closer to skin pH than what we often used to do for chemical peels, you can support the mitochondria, which keeps the mitochondria healthy, which is one of the big things we do now to control aging, is because the mitochondria is responsible for making energy, and we need all that for rejuvenation, cell turnover, skin functioning well. And the other thing that's super sexy is it actually are senolytics. What that means is they kill senescent cells. Those are those zombie cells that build up in our skin and other organ systems as we age. And those cells also, I like to say they're called zombie cells or senescent cells because they turn the cells around them also into senescent cells. So if you can get those to reverse or get rid of them and go to a non-inflammatory way of rejuvenation, then that is like the holy grail as one of the big things around anti-aging. And we actually know in that sweet spot, peels can actually do that. So that's one of the other reasons why shifting how we use peels, and that's what is really unique about the Linder Health peels, is that component.
Okay. What are some of the reasons why you would get a peel other than most people are thinking of it as just anti-aging. Is that?
It is anti-aging, of
Mm-hmm.
course. And one of the ways it does is as we age, our skin slows down in its cell turnover process. So when you're a baby, it's like every 2 weeks. A teenager goes to a couple weeks. When you're in your mid range, it's like once a month. And when you get into that 40 plus, it lengthens to even every 90 days.
Mm-hmm.
It's kind of like when you start exercising, your system is working better, the whole system works better. The other thing that happens is collagen production slows down. We lose about 1% of our collagen per year over the age of 30. So one of the things it does is actually trigger collagen production, elastin production.
Mm-hmm.
The thing that has been shown, and this came out at the last AAD, is that regular acidification of the skin actually keeps the microbiome in a healthy place. So 3 things are needed for a healthy microbiome of the skin. One is regular acidification. The second thing is keeping the skin well moisturized. So moisturization is actually more than just your skin feeling good. It actually works for keeping it healthy. And the last thing is controlling inflammation. And that, again, comes back to this thought process around why doing peels that are non-inflammatory is because it actually keeps the microbiome in a healthier place.
Okay.
So those things, and then you do things like you use the specific ingredients. You can either hydrate the skin using something like lactic acid is a hydrating ingredient. You can use, one of the peels we use is called a polite peel. We actually use glycerin in it, which is totally unique, and that hydrates the skin as well. Mm. You can do things like glycolic acid, which is actually going to dehydrate the skin. So the other thing, a big takeaway for people, please don't use glycolic acid on mature skin. It is going to dry it out. It is an old school way of thinking. Please limit your glycolic acid to your acneic or oily prone skin. It's another easy takeaway for people. And then there's super cool things that we can add like TXA, tranexamic acid, which is specifically around pigment and controlling pigment as well as inflammation and production of new blood vessels. So you can trigger and lift pigment, which is the reason why peels are the best thing to do for things like melasma or hyperpigmentation. Also great for acne, again, cell turnover, releasing those clogged pores, getting the cells to work in a better way. So basically you can do it for a variety of different organ system issues, or in terms of disease processes, or it can just be general health and anti-aging.
Okay. So we're seeing this trend, I feel like a lot of on social media of using collagen face masks and stuff. Does that actually work? Does that help?
So the reason why it does help is actually because the collagen is a great humectant. Mm-hmm. So it actually hydrates the skin from the outside. It's not actually getting into your skin and putting collagen in there, but it is moisturizing the skin. So you can use a lot of different ingredients as your moisturizers, and collagen happens to be one of them. But it's not that you're actually going to increase the internal amount of collagen that you have.
Okay. So, and you said glycolic acid is not a good one to use in your mid, 40s?
Let's say, 40 and above, I would say don't use glycolic acid. It's gonna dry out your skin.
It's in so many cleansers, isn't it?
It's in so many cleansers, and it's completely unnecessary. It's sort of, again, going backwards to go forwards. Mm-hmm. So if someone has oily prone skin, great. But if you use too much things with oily prone skin, you might even start making your body make more oil, which sometimes happens in acne. It's finding, again, that sweet spot of things. So I don't use that much glycolic acid anymore, except for I use a peel called the Linder Health Spotless Peel, and that's for acne. But otherwise, I stay away from it. Plus, it stings because it's a tiny little sugar molecule, so it gets absorbed quickly and tingles. It hurts, and that's the reason why you often have to have it neutralized or self-neutralizing. There's much better ingredients to use.
So what would you recommend to replace that cleanser? And then if somebody has acne, then what would you recommend to use instead of that?
Okay. So I personally love a salicylic acid wash or a benzoyl peroxide wash. So in general, if I have a choice, I choose a benzoyl peroxide cleanser because BPO, which is benzoyl peroxide, works instantaneously on contact because what it's doing is it's releasing an oxygen molecule. So what it does is most of the bacteria associated with acne are what I call anaerobes. So those bacteria that hate oxygen. So when you use benzoyl peroxide, it releases an oxygen molecule and kills them because they hate oxygen. Salicylic acid works great as a leave-on, or you can use it as a wash. But like for if you're using a spot treatment, I love using salicylic acid because that's anti-inflammatory, because aspirin is made out of salicylic acid. So it's going to calm things down. And then also salicylic acid actually gets in there and opens up a pore and gets the built up keratin that's built up out of there. And that actually, again, puts more oxygen into the pore itself, which makes it work better. So, and then I love superficial chemical peels for acne. So the ones we design with Linder Health can go as often as every 2 weeks. So you're really getting the process going. They don't hurt, which means your teenagers are willing to do them. I find if something hurts, the teenagers are not going to come back. It doesn't matter how well it works. They're not going to do it. So that's what's a really nice thing. It sort of gets them jump start as at least myself. And I think many dermatologists now, we're really trying to limit the antibiotic use we're using because we don't want to build up resistance to bacteria. So I think there's so many other great products out there without having to use antibiotics in acne patients. And peels are one of those things to jumpstart it. Because traditionally, that's really why we were using antibiotics, was to the anti-inflammatory component of the antibiotic rather than the antibacterial component. And so that's one of the things that really shifting the way that I personally practice.
Wow. I mean, it is definitely a chemistry lesson learning about all the different types of product that you could use or should not use on your skin.
Yep.
Oh my gosh, it can be
but
overwhelming.
That's why people are listening,
yeah.
right? It's to learn, is because there's so much information out there, and we're all trying to keep on top of it and learn about what works best.
I love it. Okay, so tell me about Linder Health and what all products do you have? I know you said you focus on a lot of the chemical peels.
So chemical peels are what we're known for, and those are chemical peels that are delivered in the clinician's office. So you would go to, a dermatologist, a doctor, an esthetician to have them done. But then, of course, we naturally have home care as well to support the skin at home. And so the products we've designed are really designed to be used for all Fitzpatrick skin types. So whether or not someone is really pale skin or they are the dark, most melanated ebony type skin, all of our products across the board are designed to be used in those situations, as well as whether or not somebody's oily or dry. So for example, the sunscreen we have, again, it's a nice gentle moisturizer, but it's not going to turn you purple. It's not going to turn you ashy if you have darker skin. That's the reason we actually called it Castaway, because it doesn't leave a cast. And the other thing is I find men like it because it doesn't catch on their beard. It just blends right in, because I believe someone is only going to use their sunscreen if they like the way it feels. Now, this sunscreen is designed for daily use. It is not water resistant. It's not sweat resistant, because you should use a different type of sunscreen for that. I like to say you choose your sunscreen like you do your clothes. You're not going to wear your workout gear to the office, unless you're like, just waist up on Zoom or something, and then use something else when you're at the beach. So our first sunscreen was designed for daily use naturally. And then we have a moisturizer that, again, goes after senescent cells. Like all of our products across the board are designed to be free radical grabbers, antioxidants, strong in terms of senescence, mitochondrial health supporters. So there's a product called Luster that's an evening moisturizer that's great for that. There's a product that we're going to launch in the summer that is a hyaluronic acid that has both small molecules that actually triggers the body to make its own hyaluronic acid, as well as working as a strong moisturizer, kind of like we were talking about topical collagens. Topical hyaluronic acid is a really vibrant moisturizer product. And then it has something in it that is like Botox in a bottle, where it actually goes after the same receptor that the neurotoxins do, the Botoxes do, but they are reversible instead of irreversible. So you every day when you use it twice a day, it actually stops those muscles from contracting, versus when you use something like Botox, it's a permanent stop until the receptor grows back. And that's why it usually takes about 3 months. So that's, I like to call like an injection type product in a bottle.
I'm going to
And
try that.
then, yeah, kind of fun one, right? So that's
Yeah.
coming out this summer. That'll be called 5-in-1, and just a little hot tip there. And then there's of course a cleanser that is again supporting for all these different skin conditions.
That's amazing. I love that you've got so many different products, but ones that you can use at home. So do they need to be purchased at the office then?
Yes, we usually like to recommend that somebody worked with their clinician.
Mm-hmm.
You can buy them directly on the website as well,
Mm.
linderhealth.com. But I always still believe that your clinician is going to be your best person to talk to around skincare, make great suggestions for you,
Right.
because they know you best and they can make wonderful suggestions in a thoughtful way. But you can buy them directly from the company as well.
Okay. I mean, that makes sense. I wouldn't want to go and just buy, I'm sure we've all done that before, but going and buying a product like that, I feel like should be something that I should have a conversation to know exactly which one works best for my skin and what, I'm looking to improve on.
Yeah. Well, that's why I always make it so that the chemical peels are for the office.
Mm-hmm.
And then I like to say all of our products are complex in terms of how they're designed, but they're not complicated to use. So they really can be used by anyone and can be used safely by anyone. But I still always believe in the empathy piece that comes from a clinician that I think is not replaceable.
Yeah. So how many offices are your products in now?
So we are coming close to 1,200 offices, and so it's growing. It's only been around for a short period of time, but it's something that I deeply love.
Yeah.
And you can always contact us and we can find somebody for you if you're looking for a Linder Health peel. My favorite ones are the ones that you can do the same day as an event, like this one that's called the Polite Peel. It's sort of like instantaneous gratification, makes your skin look glowing and fantastic day of.
Oh, wow.
Yeah.
And that's all across the U.S.
And that's all across all 50 states. We have customers in every state in the union.
That's amazing.
And we're expanding internationally now too.
So wow. Congratulations. Yeah. That's exciting.
Yeah. So I figure it's like, you start with one country and then next thing I know, there'll be 72 again. So it's sort of, I do believe that, education is like the rock piece that makes it all work.
Yeah, absolutely. So I'm so curious. I mean, you said you bought PCA first and then you started Linder. Before that, I mean, did you just jump in and say, hey, I'm just going to buy a company? Or what experience did you have prior to that running a business or entrepreneurial experience?
So I had run my own practice. So that is, okay. I mean, I think every physician that runs a practice is basically an entrepreneur, right? Yes. And so my practice had gotten to be quite large. Mm-hmm. But the thing that happened was I was very lucky in who I chose as my partner, which was my husband, who mm-hmm. is a Harvard MBA. And he had grown up in a rural part of the United States in Missouri. And actually, if people have heard of Bass Pro Shops or Cabela, mm-hmm. that actually started where he grew up. And he had worked in their distribution center from the time he was a teenager. And he was always sort of inspired by a family-owned business. And so after he went to Harvard, he knew he wanted to be in the entrepreneurial space. And when I was really impressed by this company, Physicians Choice of Arizona, we started having a conversation about it. I was like, I think I would really like to expand product development and think about the business side of it. And here I had the right-hand person. So we were like the perfect yin and yang and had different elements of the business side. And as a result, I was able to keep practicing and seeing patients at the same time as running the business. And I basically put my office next to the corporate office. So I could go literally be seeing surgery patients in the morning and then doing product development meetings or a marketing meeting in the afternoon. It sort of made it a really intellectually stimulating day.
That is amazing. I love that. That is so good. I mean, obviously it's huge to see a woman building business and creating businesses. I think that's so amazing and so inspiring. So I love that.
Well, it takes a village. And I will say my team that is still with me, many of them have been with me since 2005. I like to say it's the three of us working together. Like my name may be on the bottle, but it really is the three of us behind it. So my head of education, who's an esthetician, who is also the one who leads all relationships. And then her name is Danae. And then my PhD in organic chemistry, Dr. Ivana Vekovic. She's also been with me since 2000. I think 7 now. And then our CEO is a woman as well. So, and also came from PCA. So basically my, 4 favorite people plus a whole bunch more came over with me as well, because they become like your family. And when you really work well together and know how each other think and have deep internal respect, I think is the other thing. I think women, especially, we value our relationships and how we do things. And I think at the core of a good business is about purpose, integrity, doing things well. If you don't like the people you work with, don't spend time doing it. We always like to say an important piece of business is getting the right people on the bus. But frankly, if it wasn't for Richard, my partner, I've learned so much. I like to say, I got like a little mini MBA by like learning from, like, he was my mentor. He kind of constantly was teaching, and I still on a daily basis have to ask for advice, because it's always good to have somebody to bounce things off of.
Yes, absolutely.
Is just a smart thinker. So it's sort of, and I have mentors throughout dermatology as well, and other people, and women who started other businesses, like both Kathy Fields and Katie Roden were both wonderful to me. They're just a tiny bit older than I am, and had done both Proactive, and then they did Roden and Fields, and they were also really wonderful to share their thoughts and knowledge. And I think that's also an important thing is finding mentors, finding people you respect, people that you can ask questions of.
Yeah, absolutely. I think you have a unique approach when it comes to just looking at skincare, and also just providing that service that probably is needed in the office setting. But I think that is really such a cool way to kind of to get in and to bring that education to people just that want good skincare, that want things that are science backed, that are, that actually make sense.
Well, I think the thing is, because I continue to practice myself, and I have everyone on my team has been in the business, we understand what the pain points are. So for example, we don't have any minimum orders, because nothing makes me more crazy than when you work with a company you get excited about, and they're like, oh yeah, our minimum order would be $5,000. You're like, but what if everything you have doesn't meet what I want to do? And so literally, if somebody wants just one thing, to me, that makes sense. You're the clinician. You should be the one who's able to decide what works for you and your patients. And the same thing goes is, because of the way our chemistry is done, it can work with most skincare lines that are out there. And we like to play well with others. And I think also, as we talked about with education, it allows, and that's the reason why I love doing things like this, is I believe in allowing all boats to rise and support each other. Even now, there's other companies that I still have conversations with, because I've been in this industry for so long, to like to help them out and think about product development or around what a business problem is, because I believe that's what we do, is by helping each other out, and we all just feel better at the end of the day. I mean, we go into this field because we're people who want to take care of people, right? That's what leads us to this place in the first place.
Yes, 100%. I love that. You're saying like everything that I'm like, yes, I know. It's so amazing.
Well, because it's sort of, it's like, one of the other things that used to always, I found frustrating was somebody would come and they'd make an appointment to see me. It takes a while to get on the calendar. They come in, and then they'd want to do a treatment that day, and they couldn't do it because we needed to shift what their skincare was beforehand, or we'd do a consultation, or maybe they would leave, and then they couldn't find time to come back again. And so the way that we've designed these peels is you can do a peel the same day as a consultation, so that it makes it easier for the scheduling purpose, makes it easier for the patient themselves, because it's respectful of everybody's time and their needs. And I know myself, the day I decide I want to need my haircut, I want it done that day. Like, I don't want to have to make an appointment to consult about what I'm going to do for my hair and then come back a second day to do it.
Right.
So that's kind of the idea behind it, and sort of, again, using chemistry to solve what is a common problem.
Yeah.
And then they don't have to be limited by the season. PCA SKIN was based in Scottsdale, Arizona. So I really knew what it was like. We'd call it peel season. You couldn't do peels when it was hot. And so that was so frustrating for everybody. And that we shifted with these peels as well, because there's no inflammation. You can do the peels year round, whether or not it's hot and humid or it's cold and dry, you can still do a peel. And because people are busy, they can go out and go to their kids' soccer or baseball game, assuming they're wearing sunscreen. Like we assume that always, but you're not limited by heat. You're not limited by sun exposure. And so again, it's by understanding the sweet spot in chemistry and controlling the pH, we're able to do that. So all of a sudden, these things that used to be limiting, we can do in concert. And then with all these other modalities like microneedling or IPL or non-ablative laser, we can also do with the peel. So it makes it really easy for somebody to integrate into their practice. And it ends up sort of getting results faster with modalities that people are already doing. So it's again about just bringing flexibility and increasing effectiveness to what people's practices are.
Right. So what exactly is inflammaging and what, tell me about that topic.
Okay. So inflammaging is basically aging as a result of inflammation. So, and specifically chronic inflammation is usually one of the things that we understand now is responsible for chronic aging. So we talk about the 12 hallmarks of aging. This paper came out in 2023 that went over the 12 different things that are thought to be the primary triggers for the aging process. And inflammation is one of those things that touches multiple of these components. So if you have inflammation going on, your mitochondria aren't going to work as well. Your ability to create the right shape of proteins won't work as well. Your microbiome isn't going to work. Like all these different systems don't work as well as inflammation's happening. So one of the thought processes is if you control inflammation or inflammaging, you can control many of these other components of the aging process. And that was the major thought process shift in terms of, okay, why develop a non-inflammatory chemical peel? And it's because it controls inflammation, which helps many disease processes, but more importantly, actually can help reverse the aging process.
So there's multiple different types of inflammation, right?
Yes.
That we would
so there's good inflammation, part of your immune system, right? And then there's sort of this chronic inflammation that can be triggered by stress. It can be triggered by, we talked about senescent cells. It can be triggered by other components of inflammation can kind of get into this spiral process where when you don't get it under control, it just keeps the system going, almost like a fire that's gotten out of control.
Okay. I mean, because when I think of inflammation, I'm thinking of like acne.
That is so,
that's
but
usually where my mind goes.
Yeah, because you're exactly right. I mean, we talk about, the 4 triggers of acne. One is just the oil production, right? From hormones first, oil increases, your bacteria get under control, and then the inflammation process. And so if you don't control the inflammation with acne, you're not going to control acne altogether. And the inflammation actually makes all those other components worse. So that's the reason why things like salicylic acid are so nice to work with acneic skin, because it helps to calm it down.
And then would that be the same with like rosacea? Because rosacea is kind of along the same.
Yes, exactly. And that's the reason why I added tranexamic acid to most of our peels, is because it works under plasminogen 3. And so it actually decreases the amount of blood vessel production, as well as the inflammation, as well as the pigment component, and just sort of helps control all these different things that sort of show up in rosacea. It's sort of, we're thinking about it in a different way, because it's more about the inflammation than is about the blocked pores that you see with acne.
Yeah. So the products that, I guess when you think about stress and how that comes through in your skin, your products are designed to really support the skin and not stress it out. How can you kind of explain that approach?
Yes, of course. So this comes back down to the idea of, we talked about, you have to have the skin moisturized in a healthy way. And so one of the things we do is you have humectants and occlusives in the right balance. We have one product that if the skin is dry and cold, it actually has a thicker structure. It's adaptive. And if it's hot and humid, it opens up. So that sort of provides a healthy place to prevent basically the stresses, which are often the free radicals getting in. So you can do that through the moisturization component, and then you can do it through like prevent the ROSs and sort of trap them essentially, right? So that's the reason why we see antioxidants across the board in most skincare. So that's something that one wants to consider as well. And then we do things that go after senescent cells, like we were talking about the zombie cells beforehand. So that's another component that goes after the stressors of the aging process. And then I always encourage people to talk about lifestyle, because that is one of the important things that you want to do, because pollutants, not eating right, not giving your body the right toolkits, all have an effect. And just like any organ system, what we put into our body, how we treat our body, all has an effect. And mindfulness, we've actually shown, has a positive benefit on the skin as well, because you're controlling that internal stress and external. And so one of the things I like to do is say, choose a cleanser you like the smell of. The one that we have has got this fresh kind of aloe herby scent to it. And when you wash your face in the morning, take a breath, take in the scent, and also just take that 30 seconds to think about what your intentions of the day are. And at the end of the day, while you're washing off all the pollutants and the free radicals and stress that's on your skin, as you're cleansing, take a breath in again and think about what you're grateful for. And just those 30 seconds will actually help your body calm down. And we know that it actually does have an effect on the way the external presentation of our skin is, as well as the health of it. So really thinking more holistically is something to think about as well.
Yeah, that makes a lot of sense. When it comes to patients that are coming in to see you and they're like, I don't know what's going on with my skin. What do I do? And helping to educate them to understand what to look for. What are some things that you should be mindful of? Why is my skin breaking out all of a sudden? How do you educate them as to what to think about, what to look for, and how often they should come in? I mean, I guess getting into a good skincare routine is kind of part of that as well.
Yeah. So I always like to review what their routine is, because so often people aren't making great choices about what they're putting on their skin. It's one of the reasons I always recommend people carry product lines in your office that you like, so that you know what's in them, because your patients are going to choose something. So help them choose something that you know is good for them. So that's one thing. And then as simple as the cleanser, right? So often people, if I like to even talk about simple things like, does your skin feel squeaky clean? Because if it does, that's not a good sign. We want to take that away. I do talk to them about like, have things changed in your life in terms of stress? Like we do know hormonal shifts are often due to stress responses in terms of acne breakouts on the face, especially for women. If we're seeing our breakouts here, that is usually a stress response or hormonal response. And so we'll talk about have things shifted in that sense. Then we talk about, of course, what has changed in terms of the products they're using. What are they, can they commit to coming in and seeing my esthetician, every 2 weeks for even just like 1 month? Because even just 1 month of coming in every 2 weeks, like that means 3 treatments. I know I can shift their skin. And then I think about it as a jump start. And the other things I like to do is talk to them about, it's like the dentist. If you just went to the dentist even twice a year, but didn't brush your teeth on a regular basis, it's not going to keep your teeth in a healthy place. Your teeth are still going to end up falling out. But if you brush your teeth daily, but don't go see the dentist regularly, the same kind of situation. It takes the two in concert. And then I find while they're on the bed, we continue to have conversations. We also talk about sleep, because often that's when I find, I know that's when my skin looks the worst, is when I'm not sleeping. It's one of the reasons why with Linder Health, we even added a melatonin, GABA, and valerian root supplement, because simply to have that conversation, and it's called Calm, is because the magnesium we use is designed to help just calm things down. Sorry, it doesn't have melatonin. You can supplement melatonin with it. It can just help calm things down. And then I find the skin gets better just with that increased level of, and sometimes just having the conversation, somebody to talk to is, it's the reason why some people like to talk to the person they get their hair done with and some people don't. It all depends on what's going on. And I always talk to my person when they're on the table and be like, okay, do you want to what kind of, are you in the mood to chat today or not? Sort of, yeah.
Yeah, that makes a lot of sense. When can I schedule an appointment with you?
When can you be in San Francisco?
Right. right.
Yeah.
I will catch a flight.
Yeah. Well, third of the time I'm in Jackson Hole, Wyoming. So like, I think that's what's good for my mental health is having
Yeah.
that balance of city life and true country life.
Yeah. Gotta have a balance.
Yeah.
So my last question is, what advances in skin science are you the most excited about right now, looking into the future?
So I am most excited about the space of pigmentation because one, as I started with the beginning of my story, like my own melasma is what really got me into the space in the first place.
Mm-hmm.
And I do think we are really seeing improvements in how we take care of pigmentation. Mm-hmm. So tranexamic acid, I mentioned, you do see it in over-the-counter ingredient products, but I find those aren't quite as bioactive, which means they don't work quite as well as I think they have the ability to. So I know that's where I'm working on the product development side, is around that and other new ingredients. And I think we are understanding in a similar way as we did with the chemical peels that doing it in a more gentle way is often better. Mm-hmm. Because often traditionally we're using all these like kind of aggressive ingredients like hydroquinone and such that often are quite irritating to try to lift pigment. But if we actually think about what's happening in the pigment production process, we might be able to get to a better result without having quite the same amount of irritation, which then takes out the risk of post-inflammatory pigmentation. So I think more to come in the future. That's where I know I'm playing in the lab right now. And that's what kind of makes me most excited. And sort of this continuation of inflammaging and controlling inflammation mm-hmm. as a way of getting better results across the board.
Yeah, that's exciting. It's exciting mm-hmm. stuff. So if anybody is interested in wanting to know more about the chemical peels or finding a dermatologist that does those peels, where can they get that information?
So the easiest way to reach out to us is on socials, which is at Linder Health. It's Linder Health. Or my personally is at Jennifer Linder MD, and I always like try to respond to people. I love answering nerdy questions, so please feel free to reach out. And I like to do lives with kind of nerdy questions and stuff too. And then linderhealth.com is our website where you can find us as well.
Okay, that's great. We'll link that in the show notes as well. But thank you so much, Dr. Linder. And it was such a pleasure talking to you and learning so much. And hopefully we'll talk again soon.
Of course, I'd love that.
Thank you. Thanks for spending a few minutes with me and listening to That's Derm Good. You can expect new episodes of That's Derm Good every week. The podcast is available on your favorite app, including where you're listening right now. Subscribe to the podcast so you never miss a new episode. Bye.